When is insulin needed with type 2 diabetes? Type 2 diabetes happens when your body is not producing or using insulin properly. Unlike type 1 diabetes, which is a genetic condition and appears early in life, type 2 diabetes can occur at any time in a person's life. It is the most common form of the disease, according to the American Diabetes Association, ADA, and is often seen as a lifestyle disease. Insulin is the hormone produced by the pancreas that helps your body's cells take up glucose, sugar, so that it can be used for energy or stored to be used later. When your body doesn't make enough insulin or isn't using in the right way what is produced, known as insulin resistance, type 2 diabetes may ensue. Type 2 diabetes can sometimes be treated and handled with lifestyle changes, like healthful eating, exercise, and stress management. But some people will also need oral medication or insulin injections to help treat the disease.
When insulin is needed, there's no simple way to tell when a patient with type 2 diabetes would do best on insulin, but there are guidelines, said Richard Hellman, MD, former president of the American Association of Clinical Endocrinologists and managing partner of Hellman and Rosen Endocrine Associates in Missouri. The guidelines are based on how much sugar is in your blood. To find out the percentage, an A1C test is performed. The test measures your average blood sugar over the previous 2 to 3 months. This is not the same thing as testing your blood sugar with a finger stick, which tells you your current momentary blood sugar level. A1C blood test. When you and your healthcare provider have set a certain goal for your A1C and it's not being met using lifestyle changes and oral medications, insulin may be the next step. In general, if a patient has a hemoglobin A1C that is higher than the agreed upon goal and they are not on insulin, we recommend insulin therapy, said Dr. Hellman. Some of the primary governing agencies for diabetes management include the ADA, the American Association of Clinical Endocrinologists, AACE, and the American College of Endocrinology, ACE. These groups recommend an A1C of less than 6.5%. Diabetes is typically diagnosed with an A1C of 6.5% or higher, and a normal A1C is below 5.7%. An A1C lower than 6.5% is the goal, as long as it can be achieved in a safe and affordable manner, but higher targets may be appropriate for certain individuals and may change for a given individual over time, according to the AACE and ACE. The need for insulin. Your doctor may be more likely to prescribe insulin the longer you have had type 2. When you have type 2 diabetes, the beta cells in the pancreas churn out insulin as fast as they can to overcome the resistance your body has to the hormone. This is known as insulin resistance. This Herculean task can eventually exhaust the pancreas beta cells and diminish their ability to produce insulin. Sometimes they are unable to produce any insulin at all. The good news is that early treatment to reduce blood sugar can help to save these beta cells. There are simple steps that you can take to reduce blood sugar, like walking after every meal. Because diabetes is a progressive disease, if it is diagnosed a decade or more after its onset, the beta cells are sometimes too far gone to salvage. In this case, you may need to take insulin for the rest of your life.